the story so far. So, change minds. Before I came to Norfolk, let's go even further back. I was County Archivist of Gwent in South Wales. I was based in lovely Ebbw in the valleys. Um, and while I was there, I started to do some work with University of Newport and some service users using casebooks. And we were feeling our way as we went along. But then I got another job and left. Yeah. And that was one of the things frustrating things when you change job is you have to drop things. And so when I came out, I was always thinking, I'd really, really like to carry on doing something along those lines with those casebooks. Then one day, one of the archivists came and saw me. I said, I've had this person get in touch, and they're doing this they're a mental health charity, and they want to do something with oral history recordings. I said, oh, I'd like to meet them. So that's when I first met the Restoration Trust, where Laura Drysdale was the director at the time. And I'm going to show you a slightly scary picture now, because this will really give you an idea of how long ago that was. That one's me on the other side. I've worked out, I think I've got sort of like I've probably got about the same amount of hair on my head. But that was, I hasten to say, over 10 years ago, probably that picture was taken. So we've been doing this for a long, long time now. Um, uh, yeah, it was. Yeah, that's where I got it from. Yeah, that was on the very first Change Minds leaflet. Yeah, which we produced. Yeah. And I was wearing a tie as well. You can see that I hardly ever wear a tie now. Um, but basically, Laura and I met, and I showed her the casebooks. And one of the reasons we did the creative exercise just now was just so you've all had an opportunity to see how powerful those casebooks really are. The way in which they instantly invoke empathy. The fact that most of the ones we have and lots of other ones have got photographs in them. You know, drawing the portrait. I mean, I think it'd be quite an interesting exercise to do a portrait of somebody without the photograph. Imagination of what they're looking like. But Laura and I basically we set off and developed this project called Change Minds then. Um, what we did was we applied to the Heritage Lottery Fund, as it was then, and they awarded us a grant of £85,000. So this was back in 2015, I think, to run two projects for people with mental health issues living in North Norfolk. So that project was based around running, I think for that project, we actually did 15 workshops. What we do now is a 12 workshop model, but very similar. We did a huge amount of development work on it. We generated, we worked with the NSFT, Norfolk Suffolk Foundation Trust, and the service user consultant bodies. We worked with UEA on an evaluation methodology. We developed on what we were actually going to do during the sessions. We did digitization, but we had to do a lot of thinking, and a huge chunk of that money went down to that project development. And then we ran two workshops. So if you think about it, those two workshops, probably half the money went on project development. Let's say half. So say 42,000 went on project development, £42,000 went on actual implementation. That's £21,000 a workshop. Um, but actually, because all that development cost was included, that was £82,000 per workshop. That's 42,000. My maths isn't very good today. £42,000 per workshop, which is expensive. Um, Appropriate. Um, and I think earlier we saw that how important it is for participants not to have any costs. So a big chunk of that was on transport costs and that sort of thing, and supporting people. Um, so we ran those projects. Um, and Change Minds, I'm going to talk about it as a 12 workshop methodology. Really, it can be broken into it's sort of broken into two sections with a bit in the middle. Everybody starts in workshop one by having an introduction to the record office. Um, 98% of participants will have never been in it before, but that's pretty to the general public anyhow. So there's nothing that unusual. But it's also about getting people, most people feel a little bit intimidated visiting a facility like this. Um, I've worked in 5 different offices now, and I don't know what I'm doing if I go into a new office. Not that I do very often. Um, so there's that thing, but and it's also, it's about the methodology, about the whole thing about having plenty of space and time and making people feel comfortable. Um, then after the first section, we have a tour around the building. People go in the conservation studio, which is always difficult to get people out of because it's fascinating. Um, First session, we do evaluation. So we're taking a snapshot at the start of it. Um, then the second workshop is about people choosing one of those cases, um, where that becomes their person. Um, and that's the person who we do a bit of paleography training, and those people, the participants, then work on that person, look at their case record, but then in subsequent workshops, learn some research skills and do research into that person. So there are a couple of things around that, really. One is we always choose, well, 99% of the time, we choose people who've got a positive outcome, people who've come into the hospital and people who've left recovered. A number of good reasons for that. One is it's a good positive outcome. Um, a more cynical one is, well, actually, if they've come into the hospital in 1885 and left in 1887, well, there's going to be an 1871 census and an 1881 census on either side. So we're setting people up for success. But perhaps an even more important reason for doing that is the research means that people are looking at those people not as people's life is defined by their stay in an asylum. They're looking at the whole life. These people's lives were so much more than that. And it is part of that whole approach to somebody's life and the reflection of that wider definition of a person. Um, so if you haven't seen enough of them already, there's another one. But we have literally thousands of these. We had a volunteer project, which ran for a while to catalogue the case records which are open, obviously later case records, ones from the mid-ish 20th century aren't publicly accessible. But I think it was about 4,500 cases are in that indexes. These are great big, well, as you can see from this, there is, oh, God, I remember to use the pointer on the laptop. These are large tomes with hundreds and hundreds of pages in them. Um, but one of these people is the subject of each individual's research, so everybody's doing something different. Um, at the end of that first research phase, if you like, we usually have an outing. Um, in Norfolk, we've been to Gresson Hall Workhouse Museum quite a few times. Brilliant place to go. Looking at Rachel, who sat in the room, is the curator there. But it's there are plenty of places which could be visited, but what really works well with Gresson Hall, otherwise the wonderful welcome they give us, is the fact that, look, this is a pauper lunatic asylum, as it was called at the time, and people were often bouncing back and forth between the two. But it's also on a sort of wider scale. It's a similar sort of institution, and it's got lots of similarities to perhaps the way people felt when entering. One question which I have asked, I don't have an answer to, is, which of those two institutions do people feel more comfortable entering? um, I do have an answer to that question. What that outing does, is it's a really good way of bringing a group together. Rob mentioned friendships, and actually the group coming together, actually supporting each other and developing those relationships is an important part of it. Having the space in the sessions to do that, and yeah, and people, I saw somebody today who I haven't seen for about 8 years. It was really good to see them again. Yeah. Um, After that, the project moves on to the creative phase. So we have a series of creative workshops. The idea of the creative workshops is that people take their learning, what they've learned about the person they're looking at, They're learning about the asylum and learning and their own experience and reflect that in lots of different creative ways. And we've done lots of different things. We've definitely done drawings of people's heads with words on them, because you all experience that. We've done textile art. We've done, well, I've got some examples in a minute. When we came to the third Change Minds project, third or fourth Change Minds projects we did, which again we got money from the lottery for, which was when we went a bit off piste and we decided to do something around about Dr. Hills. So with that project, we used the same methodology for the first creative part of Change Minds. But then rather than employing creative consultants to come in and facilitate a session, we employed actors and a writer to work with participants to produce the play, um, which was very interesting. So here are some examples of some of the creative work. I'm not going to read this poem out. I'm just going to pause for a few seconds. You can't read it. I'm going to have to read it. So it's Flora Cooper. Person who chose this chose it. I think she was interested in made her own dresses. Flora Cooper was a seamstress. Um, so there was a sort of connection there. Well, nothing, people choose their cases based upon loads of different things. It might be where they live, just might be something that sparks a connection. And then we had a creative facilitator come into the second session, and one of the things which a creative facilitator did was poetry workshop. Um, I don't think many people in the session had ever written a poem before. um, so back to what Sally was saying about challenging, something new to do. And this is just one of the poems. So it reads, a few days after Flora's marriage, she became very unnatural in her manner. Her husband has not since been heard of. Through necrosis, she is rotting from her roots. She has saved people in her night ramblings, was going to be married again. I'm fixed to the earth by needles, fixed to the earth by benefaxi, there is sky and the damp give of the ground. Flora has a mouthful of needles. She is making dresses in the blue shape of us. In the spring, we'll stand, face the low sun and the breeze, promenade ourselves home. Uh, I think it's a lovely poem, but it's that, challenging people challenging themselves to do something new, perhaps something they're not comfortable. I know I was speaking to some people before, when I said there's creative exercise, people said, oh, no. Yeah. Um, these are some examples. So you're familiar with the sticky tape on the portraits, collage work. Well, this is one of the two collages which were done. I've got the positive one. The negative one is very dark. More collages. People did concertina collages, which we displayed in the case. Um, and this was another project which was based in Lancashire, in Preston in the archives. And this is a very short video. So how do I start it? Do I just...
This is my found poem about George Rowland Hampson, and I call it Passenger Fares Are Collected at the End of the Journey. He is peculiar, foolish, and insane in behaviour. I was a boy of 16 who worked on the trains. I made a mistake. No more, no less, but my freedom was taken. He is of degenerate type and is probably a case of congenital mental deficiency. My medals say otherwise. I risked it all for my nation, my blood, my life, for your freedom. He refuses to answer questions of any kind. He wouldn't listen, so I had nothing to say. Passenger fares are collected at the end of the journey.
So people have done lots of creative work, as you can see, lots of variety of creative work in there. So now to more of what we actually, the methodology. Um, Question came up from Helen earlier about, being able to do these projects, and I said I'll be talking about money, which I will be talking again after the break. But um, these projects aren't cheap to run. We could run Change Minds here, and we could have a poster up outside, and we could fill up each session. We could fill up the whole course. But is that a good use of tens of thousands of pounds? So the Change Minds model works very much on the fact that we do need to direct the resources we're spending at those who are going to benefit the most. I haven't included in this slide deck, but two slides I've included many times before is I've got a slide which looks like a pie chart. It's not a pie chart. It's just a multicoloured chart listing all the things Norfolk County Council does with its budget of about £2.2 billion a year. But then the next slide is actually a real pie chart, and everything apart from children's adult services is Pac-Man's mouth. It's all squeezed into that, but it's making the point that actually what we do in our areas, which is a benefit to that huge part of the pie, is actually, as well as being good in itself, is actually really good for the service in its profile and the way it's seen as actually playing an important role in a really crucial objective of the local authority. Um, so that works on that model, and this is the model which we had for the very first Change Mind project. So the Restoration Trust was our partner we developed the project with. And the Norfolk Record Office has got historical expertise in the archives. We did it in this room. But we were in partnership with an organisation called Together for Mental Wellbeing. It was a support organisation in the community. And that organisation acts as a recruitment body for encouraging people to come along. So they are most Change Minds projects work with a partner where people are in receipt of a support worker. So it means that people are going to, you're directing what you're doing, where you're going to have, hopefully, the largest impact. One of the things which we did a lot of work on, as I said earlier, when we were developing Change Minds, very first of all, was evaluation. We've developed a WEMWEBs. We started with SWEMWEBs and moved on to WEMWEBs, which is the Warwick Edinburgh Mental Wellbeing Scale, which is a widely recognised well-being methodology. It's been used lots and lots and lots. We don't. We have questionnaires at the start of Change Minds and questionnaires at the end. What we don't have is statistical validity. Because you need a lot of returns to get statistical validity. And part of the process of, one of the things which stands above everything else when I do training on Change Minds to people, one of the first things I say is Change Minds is about the well-being of the participants. It's not about, it's not about, even though, what I just said about how it's good for the service, that is not, if anything interferes with the well-being of the participant, it shouldn't happen. Yeah, it is about improving well-being, and that overrides everything else. But so one of the things we do is we make it very, very clear you don't have to do the evaluation. We have, we're archivists. We know about all the informed consent and data protection, that sort of thing. But it's very clear, it doesn't have any impact on your self-taking part, which probably lowers the rate of return a little bit. But what we do have is very, very good, powerful, qualitative data from feedback which we get. Some of the projects we've had focus groups as well, but people have enjoyed it. They've made friends. It's been interesting. Develop confidence. I think some people have. There was one project actually which was in Bristol where at the start of the project, I think somebody, I don't think they've been out for a long, long time. At the end of the project, they got on a train and went and visited the grave of the person they'd been researching in South Wales. But that's potentially life-changing, isn't it? Building up that confidence as you go through. And lots of quotes. And I think one of the things which the evaluation really brings out for me is that, please, really brings out for me is the empathetic relationship which people develop with the people they're looking at. You do. I mean, there's one there, isn't there? Has it got the one on here? I haven't got my glasses on, so but there might be one on here which talks about how somebody was going to London to meet some friends. So they took the person with them to introduce them. Yeah. That's on there. Oh, yes, I went to London and took a share with my friends. Yeah. Which is great. Um, so what we found is, I mean, just from my own personal experience, it's been good for my well-being. And actually, some of the feedback I've had from other projects, actually, staff get a lot from being involved in Change Minds. But I just know it's been good. But that's not good enough for the money. But I'll come more on to evaluation in my second part. So we started Change Minds with this project, £85,000. We ran 2 Change Minds projects. We had a little bit of money left over at the end, so we ran a conference here. In the days before we could put it online, pre-COVID it was. But this room was sold out. Even though it was free, it wasn't. We didn't charge people to come. But there was a huge amount of enthusiasm. People came from Scotland, from Wales. And one of the questions which I asked is, well, are you interested in what do you want to do? And loads of people said, well, we'd really love to run our own Change Minds project. Great. And I sent out a call for expressions of interest to archives. And I think I had 28 people coming back saying, yeah, we'd like to run a Change Minds. And that's sort of like, that's that head scratching moment. Thinking of that partnership model with the 3, the archive, the mental health service, and the support which Restoration Trust and Norfolk Record Office gives, and getting 26, 27 of those partnerships ready together all over the country. I think the expression is herding cats. um, so we had a think. Did the Dr. Hill's Casebook project in the meantime, got some money from that. But what we actually took inspiration from, sort of, this is a bit post facto, but the example I give is, say you wanted to, you had an ambition to sell takeaway food, and you wanted to become, a chicken was your favourite. So you wanted to set up a fried chicken takeaway. So what you could do is you could develop your own blend of herbs and spices. You could develop your own health and safety training. You could own customer satisfaction methodology, get your own marketing materials, come up with a slightly dodgy name like Louisiana Fried Chicken. It'd still look a bit dodgy. Or you can ring up the Colonel and say, I want to run a KFC. And we're not running KFCs. It's not formally a franchise model. But the inspiration was, well, how does a franchise work? What do you get when you buy into a franchise? So what we developed was the idea of a Change Minds hub, which can support the delivery of Change Minds projects. So the hub, it's a partnership between Norfolk Record Office and Restoration Trust. And we are here where we can help develop projects and we can help with the delivery of projects. But the big part of that is a manualization of the process. I'm going to talk about this more after the break, but where we take Change Minds through a step-by-step process. So it means that people aren't reinventing the wheel again. The thing I said earlier before we did have our coffee about how if you have to repeat that development work all the time, the cost, your social return on investment, actually is really low. But if you can do it where you're not having to repeat that, it isn't. So those first 2 Change Minds projects cost £40,000, at least £20,000 each 10 years ago. The outcome of the scaling up Change Minds as the lottery funded projects, which we're coming to the end of now, was a Change Minds project cost about £10,000 to run now. So that's half the price, which is, well, economics is very, very important. As we'll be finding out in 2 weeks' time, I think. Now, the Change Minds, scaling up Change Minds project, I've got the word on here, but I'm slightly uncomfortable using it. It's in the next slide. So, that's the model, very similar model. So, got Change Minds Hub, Restoration Trust, a mental health service provider, which is for the local project. So that's recruiting people and providing other areas of support during the project, and an archive service. And we had developed loads of materials. We'd done loads of work for the earlier Change Minds project, and we printed them all out and put them together. But, it was just a big, thick ream of paper. So what we spent a lot of the time in the project doing was creating a step-by-step guide, which I'll show you later. But we don't know everything. So part of that project is we chose 6 projects to work with to help us develop those resources and test them. The word I hesitate to use, I've got the word co-creation here, and I think it's a bit overused, the word co-creation. I'm slightly hesitant about it, but it was because we worked with them. Some of them were early in the project where we were developing the various web resources. Some of them were later in the project, and that was a really useful process. But we ran 6 projects. So Norfolk Record Office, we went off piste again, which was a bit of a challenge. And Vicky and her team went to Norwich Prison and delivered Change Minds, which was a steep learning curve. Yeah, we learned a lot from it. Lots and lots of problems of delivering Change Minds in prison. I think people got a lot of it, but people keep on leaving. Rude. But also there's all the stuff about getting in and getting people into the central place and loads of other things. But interesting. We ran it at Bristol Archives. Well, Bristol Archives, they are the lead on the project with our support, and they ran it with Richmond Rethink was one of their partners. So that was the mental health service provider. Great project. University of Dundee, who Caroline there has been doing work in this field before, so they had good connections with the community. Bethlehem Museum of the Mind. I don't know if any of you have ever been to the Museum of the Mind in Kent, but it's a great museum. But they're on the site, the South London and Maudsley NHS Trust, so they had quite good links in. Lancashire, the film I showed you just now, that was done as part of the Lancashire project. But Lancashire's part was the NHS Recovery College, which I think is a really good model for that, for delivery. That's what they're helping with. And the final one was another Norfolk project, which we brought in slightly later because somebody had to drop out of the project. But we did something slightly different. Our partner in this was the FE College in King's Lynn, and we worked with educational support services and delivered a Change Minds for young people. So we were looking at a different sector. But again, all of these went really, really well.